What is fifth disease? Fifth disease, or erythema infectiosum, is a highly contagious ailment that only affects humans and results in a rash on the face, trunk, and extremities. It is most frequent in children between the ages of 4 to 10, and outbreaks tend to be more prevalent in winter and spring. What causes fifth disease? It is caused by a virus known as parvovirus B19, which can be spread through saliva and airborne transmission, such as coughing and sneezing. Due to its high prevalence among children, the rate of disease is highest in schools, which increases the likelihood of the disease spreading. What are the symptoms of fifth disease? The symptoms of fifth disease can vary from person to person and may include headaches, fever, nausea, and a sore throat. These can last a few days, and in some individuals, a red rash appears on the cheeks, which gives the appearance of the face looking like it has been slapped. Additionally, the main symptoms associated with fifth disease in adults is joint pain. After several days of the rash appearing, it may spread to the trunk and extremities and reappear for up to 3 weeks. Exposure to the virus develops antibodies, which reduces the likelihood of secondary infection to parvovirus B19. Although, even in a healthy adult, previous exposure may not always result in immunity. Healthy people, or those without compromised immune systems that contract the disease, usually do not need to consult a health professional, as their body is able to fight off the infection on its own within 1 to 3 weeks. As there is no antiviral drug available for the treatment of B19 infection, treatment of patients with no other health complications involves relieving symptoms. Paracetamol and non-steroidal anti-inflammatory drugs, such as ibuprofen, can be used to alleviate symptoms such as headaches, fevers, sore throats, and reduce the severity of joint pain. Antihistamines are useful to reduce itchiness and runny noses. However, for immunocompromised patients, such as those with cancer or HIV infection or hemolytic anemia patients, fifth disease can cause extra medical complications. In this case, they would need to seek medical attention by a health professional. Treatment for these patients may involve intravenous immunoglobulin injections, erythrocyte transfusion, or even hematopoietic stem cell transfer. If the infection is contracted during pregnancy, close monitoring of fetal blood along with ultrasound scanning can confirm if the baby has contracted the disease too. In this case, intravenous immunoglobulin administration and intrauterine blood exchange transfusions can be beneficial. In taking proper precaution to make sure that your baby is okay, it is best to seek medical advice. For a relatively healthy person, reliable evidence suggests that any extreme treatment, such as immune globulin therapy or hematopoietic stem cell transfer, is not recommended, as the body is usually able to fight off the infection by itself. These treatment methods are unnecessary for patients with healthy immune systems, as they only need something to reduce the severity of their symptoms. However, for pregnant women who have encountered the disease, the evidence recommends that they seek medical attention for close monitoring of the baby, as it may develop severe anemia and result in a miscarriage if undetected. Despite the higher cost of blood transfusions and immunoglobulin injections, the evidence still advises that patients should seek these treatments if they have compromised immunity, as it could be the difference between life and death.